Get my agenda in front of me to stay on track here. So hi everyone, welcome to our November UHA meeting. This is our last UHA meeting of 2024. It's hard to believe that this year has gone by so quickly. Before we get started, are there any mission moments or happy occurrences that anyone would like to share?
This is where I'm going. Jen,
Now or later?
Sure, now if you're ready.
I don't. Kim wanted me to wait at least till today instead of yesterday.
Okay.
So, because it'd be better for the UHA first. I know everybody's like, what? So, this is really, really, really good news for our UHA. I am in the process of getting master trained for DPP. So I will be the master trainer for the UHA. So I am at your disposal now. So if you have anybody new that's coming in as a coach, here we are. We have somebody on staff then to help with that. So you don't have to go hunting around wherever. And we get to work on that as a group.
Mhm. Yes, that is so exciting. We're so lucky to have you, Jen, stepping into that master trainer role. So when you started the training, when will the training be complete?
Um, Middle of January.
Okay.
So after that, and then we can get set up training time and go through some of those other things in there too. So, yep.
So yeah, so everyone, as you're thinking about future training needs, just keep Jen's new availability in the back of your mind so that we can start figuring out when makes sense to have a training for next year. Because I know, Jen, you'll have some requirements around needing to offer a training within a certain time of becoming a master trainer, correct?
Correct. I have to be able to offer one within the first 6 months after I've completed. After that, then I'll just have to do one a year unless the group needs more. So it's just within the first 6 months to be able to apply what I've learned and practice and all those other advanced coach master trainer skills.
Mhm.
Mhm.
Absolutely. And welcome, Flo and Sarah. Glad to see you could join us today.
Thank you. Good afternoon to everyone.
Just
Hi.
sharing. We're just sharing any mission moments or happy occurrences. Is there anything that you'd like to share, Flo, that's going on in your world?
I'm just excited that after the first try of starting up DPP, we are working on looking towards January 6th to start visual, and I'm just hoping that we have enough people register for it. So I'm trying to do a lot of outreach so that we could be able to get people. So it's exciting to talk about people who are risks at diabetes when people who are diabetic already need it. So they said, no, don't do that, do this. I said, okay, we'll see how best we can handle both. Yeah, so anyway, so that's the exciting thing that I'm doing now, and I'm excited people are listening and they're really interested in the stuff. I just hope they register.
Yes. 25 is a new year. It's a great time to start. January is a great time to start a DPP class. So I'm sure it will be a great success. Welcome, Ginger.
Hi, and that
everybody.
Flo is. Oh, hi, Jen. Sorry, and then Flo is going to do it distance learning too. So just so folks know that as well. So that's pretty cool.
Yes. All right. So moving on, I have a bittersweet update to share. Some of you already know, Mary Kay, you already know that our friend Stacy Dunn, she has accepted a new position within Trellis. So she is going to, as of November 20th, be one of our Older Americans Act grant managers. So she'll still be in the social service space. She'll still be at Trellis. Some of our partners in the metro area might still work with her through the Older Americans Act grant, but she won't be on our Juniper team anymore. So it's very bittersweet. We're excited for her. It's a fabulous opportunity, but I'm sad for me. I'm sad for us. Oh, it's a balance. Um, Her transition period has been a little bit unique because Stacy's actually been off quite a bit the last 2 weeks in a caregiving capacity. So that's why you haven't seen her for a bit, but she will be back 100% Juniper on the 18th and 19th, helping to do some cross training with our team and wrapping up some things. She'll still have the same Trellis email even after November 20th when she transitions. So she'll still be here if you want to reach out to her to just see how she's doing and how she's liking her new role. But when we think about who's stepping into Stacy's responsibilities over the next period of time, we're not planning to immediately hire to fill her position. We're going to take a bit of a pause as on our community care hub expansion side of the house, we have some things in the works that might change what we need for as an organization. So for now, I am your primary contact for everything to do with the UHA. So you can reach out to me, and we have our amazing support team here. Ginger is going to continue doing DPRP reporting for us. And Aaron and Lauren are stepping in to check MDPP eligibility and confirm eligibility, and they will continue as they have been handling the billing side of things. So when they're checking MDPP eligibility, this is a bit of a change, but they are going to be checking it one time right before the class starts, so 1 to 2 days before the class starts. The reason being so we can confirm eligibility and start billing right away. Our ask from you is that if you get a lab test or some other important documentation that would allow us to bill beyond that first session, please reach out to me so that I can let Aaron and Lauren know to go back in and check MDPP eligibility so that we can bill for that individual. Any questions about that? Okay, hearing none, I have a question for you. Sometimes when Stacy and I would check MDPP eligibility, we would follow up with you or the class leader to say, hey, so excited, class is getting started. I checked your class. This who is DPRP eligible. This is who is MDPP eligible. And these are some things that we're missing that might make it so we can bill for this person or to be able to confirm DPRP eligibility. We've been doing this work for a while now, so everyone might be feeling more comfortable with confirming DPRP and MDPP eligibility kind of on their own at a glance and knowing what's needed so that we can bill. So all of that to say, to get to my question, is it helpful for Aaron and Lauren to send you a summary of who is MDPP eligible and we will bill for, who's DPRP eligible, and anything that we might be missing to help guide your focus on what documentation to collect? Or do you feel like you have a pretty good handle on that at this point?
I would find it helpful. Only for the fact that last year, when I entered all this data in, and Ginger can recall this, I entered in about 4 times and a little gremlin just kept eating all the data that I was attaching. And so I assumed everything was in there, only to find out there wasn't a whole lot that actually stayed once I tried to save it. So it'd be helpful to know what attached and what did not.
Absolutely. Thank you,
I
Mary
think we've
Kay.
squashed most of those gremlins, Mary Kay, but thanks for taking me back in time. You never know when they may reappear.
Yeah, we're happy to send you guys the information if that's helpful. We're already in there and doing the checks, so it's just recording it and sending it. Just didn't want to flood your inbox if you already knew and had a good sense of who you needed what from, but
Exactly. Exactly. We don't want it to be a situation where you're thinking like, oh, Lauren, I know this. Like, stop. Don't pester me. I know they need a lab test. I'm working on it. So if it's helpful, we will continue to do that. It will just be the one-time check though. So again, if you collect additional information, let us know so that we can recheck. So that reciprocal communication will be really important. All right, moving on to the new contract structure. So all of our, well, 99%, we have one contract for the UHA that is not expiring until later in 25, but all other UHA contracts are terming December 31st, 2025. So we are going through contract renewals with all of you. You'll notice that we're making a change for the contracts for 2025. Previously, up till now, we had a separate contract for the UHA and a separate contract for organizations offering other evidence-based health promotion programs. So some organizations like ASA Southwest Minnesota, Vine, you had two contracts with us, one for each of those arms. Moving forward, we're going to just have one contract with different attachments based on the program type and funding source. So if you're part of the UHA and offering DPP, you will have a unique attachment for that. That outlines the reimbursement schedule for your DPP classes. All classes will have the evidence-based programs included in there as an option to offer, but if your organization is not offering evidence-based programs and has no desire to offer them, that is completely fine. We're just putting it in there as an option and to help standardize the contracts for everyone to reduce duplication. Also, we have understandably gotten questions from some of you asking, we know the UHA at some point there might be a fee to cover the cost of submitting claims, the cost of the DPRP reporting, and the cost of maintaining your juniper.org. And we understand why you have those questions. As we shared back in September, we don't have any immediate plans to have a UHA fee, but we did make a verbal commitment in September that we would give 60 days notice at a minimum. So we did include that language in the new contracts just to reflect that verbal commitment. Any contract related questions? Well, if you do have contract related questions, please take time to read the contracts. We know they're quite long, but they are important. They outline our commitment to you and your commitment to the UHA and our work here. So we want to make sure that you feel comfortable with that language and that we are working through any questions that you might have. So next, I was hoping that to give myself a break from talking. Mary Kay, did I see you on mute? I'm sorry.
I just had a quick question. When do you think the contract's going to come out?
Well, yours I know is a bit delayed because of the name change that we needed to do. Lauren, do you have an update there?
Honestly, I thought it was out. So bear with me. I can.
Well, maybe it is. If you can check.
I was just going to say thanks, Mary Kay, for getting it changed with DPRP too.
Yeah.
I just looked at it and see that they got it changed correctly. So thanks for doing that.
As long as everybody can see it on their end, then it went through.
Yeah.
Okay, now I just gotta ask, what name change?
We went from Community Memorial Hospital to Community Memorial Hospital Association. That was our legal name.
Okay, Thank you.
All of our
What a
contracts. Yeah, so for all of our contracts, we have to have the legal business entity as filed on with the Secretary of State. So we'll probably still call community memorial. I doubt we're going to add association into our everyday language, but for the purposes of the contract and billing Medicare, it's just a box we needed to check. Lauren, it looks like you had an update.
Yeah, I was just gonna say, Brad signed it, so can I get you a copy, Mary Kay, or did that not make it to you?
It did not make it to me. Is that the new contract for 2025? Or is that just
Yeah.
an amendment to get us to the end of the year?
This is the full 25 contract that I'm looking at.
Yeah, so I'm remembering now, we asked Brad to sign it on a specific day when your previous agreement was going to term so that we wouldn't have to do the amendment. So this will carry us from the date of signature through 2025.
Okay, so there's nothing else we need then on our end.
I don't
No.
think so.
Okay, good.
You're set.
Okay, back to giving myself a break from talking. I was hoping we could do a quick round robin about any class plans for 2025. Of course, each of you are individual organizations and you'll make plans in accordance with your capacity, but it is helpful for us to have an awareness of each other's classes so that we are not my husband works part-time at Target. I don't love this term, but they use it at Target, self-cannibalizing. We're not taking clients from each other, so to speak. Anyway, it happens at Target when they put two stores too close together. So if you can think of another term, please let me know. I'm open to it. I feel very Donner Party using that language. So anyway, any tentative class plans for next year? When I say tentative, I'm just thinking like what month you might want to start and if it's in person or online. And if in person, where you think you might have it.
I can go. We just started a group this week that's going to go into next year. So we don't plan on starting another group probably until later next fall. Unless we can find a large group of people who want to join and do a group before then. So if anybody has any extras that they can't quite get into a class that happen to live in the Cloquet area, we are going to be offering it in person with the distance learning. We have one distance learning person right now who joined this week, who is a snowbird and went to Arizona. So we're going to try that, see how that works.
Okay. Please report back, Mary Kay. I'm curious to hear how that works for DPP.
So am I.
Hopefully well.
I can go next. So my class plans as of right now for 2025, we have one starting the first week of February. It's a Tuesday afternoon in person. Our next one would be April, like middle Thursday morning. And then next fall, we have middle of October scheduled. And that's a Wednesday afternoon as well. And those are all in person. Now, as I end up honestly training new coaches, I will probably be adding a couple other locations besides just our facility. And then those will be determined depending on the need, mostly because we've had requests from LeSueur County way up out of the area that they don't want to come to our location, and then Waseca County as well. So that would go under our DPRP code then as well. So then we'll add that to, and those three classes are already on the MIS. So then I'll be adding those classes when we get to those points as well.
Jen.
I can go. I am just going to be completing the class that I started in August. So I'll complete my first class in August, and I'm not planning on any more after that.
Jill, I remember Michelle mentioned that she might have a second leader trained. Do you know, I forget her name. Do you know if she's planning to offer any classes?
I have no idea because Sam just had her baby.
Oh, sure.
So I don't know how much she's even working at this point.
Okay. Thank you. And Flo, we know you have a class starting in January.
Yes, it will be distant learning in January through the year. So we're just hoping that we get more people registered.
Absolutely.
Yeah.
Thank you, everyone. I did hear from Natalie at Centric Care that she's not quite sure what her plans are for 2025 yet. So she has some other big projects that she's working on and just started a class this fall. But her class would likely be online again. So hopefully we'll get plans from her later on and plans from other partners later on as well. One thing just to keep in mind before I forget, I have this note here. So we reached out to CMS because they've done some email marketing to Medicare beneficiaries in the past that has always seemed to create a little bit of an influx of phone calls for our partners and with people looking for DPP classes and interested in signing up. So we wanted to try to figure out when will that happen this year. And what they were able to share is right now they're planning to do email outreach around the third week of March for Diabetes Alert Day. So just a marketing effort to keep in mind for your classes in 2025. Probably won't get 20 people in cloquet as an extreme example from this sort of a marketing effort, but sometimes we see like 1 to 2, 3, depending on, just depends on who opens the email. So something to keep in mind.
Rachel, were you ever able to get a copy of what the email says? Just so curious. Huh.
No, I haven't, and I know that's something I can ask Allison for when we get
Oh,
closer to
yeah.
March. I could put a note on my calendar to ask her for it because that's been one of our questions in the past is what link are people being sent to look for classes because um, I have opinions about certain sites being more helpful to find classes but I know that they have to promote in a certain way as well. All right. So moving on to a billing update. And Lauren, please feel welcome to fill in if I miss anything here. I'm going to try to do my best. So as we shared in September, we've submitted applications with United Healthcare, Medica, and Humana to be a in-network provider for them for DPP. So this is what this means is we're just applying and accepting the Medicare rate or the Medicaid rate. We're not trying to negotiate a higher rate in any way, shape, or form because we want to get that contract solidified so we can just get things moving. So Humana has gotten back to us with requests for additional information. And for example, they've asked for a certificate of insurance. So we're going to be following up with them and working to collect that information that they need to add us as a in-network provider. And Medica at United Healthcare are not quite as exciting. We're continuing to follow up weekly. We haven't heard anything from them yet, but continue to be persistent in the effort.
Can I ask a quick question, Rachel? Or Lauren, either one. If we move forward and they do accept the contracts eventually, would it go back to the original application date or would it go from the date that they signed?
That's an excellent question, and it sometimes depends on the MCO's policies and procedures as well as maybe how they're feeling that day, it seems. Typically, I've seen more examples of them not going retroactive than I have seen them saying, look, we signed it in January, so it's going to go January 1st and continue
Okay.
on. Not, I'm going to put it back to July when you actually started this process.
Okay. Thank you. That helps
Yeah.
for clarification.
But yeah. Yes.
So can I ask a question? Yeah. So I get really crabby about this because by law, they're supposed to be covering this service. So by saying we don't have a contract with you and no, we're not going to pay is BS. So at what point do we get to call it BS and say, we're going to give you the last 2 years worth and you're going to pay? I'm sorry, I'm being so crabby about this, but I really am crabby about this. And I know it's not your fault, Lauren. I'm just saying these advantage programs it's ridiculous that we're fighting this hard. So this is where I want to go to CMS and say, you guys need to help us. This is not working for us. So getting on my soapbox, now I'll shut up and get off.
Tim, I think you articulate how many of us feel. So we've had MCOs tell us we don't have to cover DPP. And we know by law that they have to. So it's an interesting process.
Yeah. And often they aren't sure what DPP is. That's been my experience, is that it's educating them about what we're talking about. And so I think that's part of the confusion in the lag, is that they're not sure where to put us. And if it's unclear, then people just don't do it. I think that's kind of human nature. It's not okay.
So I'm sitting here going, okay, so what could I do to help you guys, right? Because like that's part of what I need to do too, is I can be the bulldog, and then I got the dog in the fight, but it's it's different, right? It's the state saying, hey, this is a equity issue, this is a not that kind of a thing. So let's spend some time at a different time and circle back on this and see if there's something Martha and I can do at a national level, because I'm kind of feeling like you guys are one of like many organizations that are having this continued frustration, and we got to get this message up to CMS that they have to be part of the solution with us to educate those Medicare Advantage programs to get off their butt and pay the claims and get the contracts out the door. That's how I feel about it. Like, so if I can help you guys do that, I want to do that.
Sounds good. Yes, it sounds like maybe an offline connect.
Yep. Okay, I'm gonna shut up again now. Bye.
All right, so shifting gears a little bit to something to celebrate, our UHA was featured in the October MDPP newsletter. And I was reading it just briefly, I'm sharing the link in the chat, just skimming over it. And I don't know when it was written. I imagine earlier in 2024, which feels like so long ago because it's referencing the work we did around social determinants of health and the screenings that we did there and some of the marketing efforts that we did. Like I think of the buses that Duluth YMCA did for marketing, and the video that Jen helped us do with participants from kind of all over the state that we did to create a little highlight reel of diabetes prevention programs. So it felt, even though it wasn't that long ago, I know it was nice to reflect on all that work that's been done. And because sometimes we get so in the daily grind, which we need to be present and getting our stuff done. But it is helpful to reflect back on how far we've come and how in only 2 years ago, we were just becoming a Medicare supplier. And that was a really big deal. It still is a big deal. And we continue to see progress for our UHA. All right, and then just moving into our general announcements and discussion time. I have 2 questions for you, well, a comment and a question. One, the comment is to let you know that Trellis is moving. I don't know how many of you know that I've shared that with. Some of you have seen my office in disarray already, but we are going to be moving into a new space in 2025. The timeline with the move is such that our team is going to be working remotely from about the middle of December until probably the end of February, maybe early March. We need time. We have to be out of our current space before our new space will be completely ready for us. So there will be a window there where we won't be able to as quickly mail out Juniper brochures or information. I won't have access to my big industrial printer to print things for folks, or and our address might not, our mailing address is certainly going to change, of course. So if you do have any requests for Juniper DPP brochures or other Juniper materials, please let me know before December 6th. That's the date when we're going to pack up the warehouse. So Erin and Lauren and I, we're going to be wearing comfy clothes that day, boxing things up. Hopefully we'll have our fingertips intact by the end of the day with all that tape. And then please watch for information about our change in address if you do by chance need to mail us something. And then my question for you is, our next meeting is going to be January 9th, 2025. So is there any interest in seeing some sort of a data recap of 2024, or even data recap of what the UHA has done since we became a Medicare supplier in 2022? I see some head nods in different directions. Okay, so it sounds like it would be something worth doing.
I love data. It helps us tell the story. I'll speak for Martha. If Martha were here, she'd be going, "Oh yes, let's," because we geek out on that, right? So that's really helpful. I would also love to add Medicare Advantage claims not paid to that wish list of data. From by company, by dollar amount. Okay, now I'm really diving too deep. Sorry, Lauren. Take a breath. You don't really have to do that part.
Yes, right. That is an important thing to look at, right? Is what is there's what we're doing, which we can celebrate, and then is there a gap, an opportunity for improvement from the health plan side, from participants sharing lab tests and filling out pre-surveys? Where's that opportunity? All right. Any questions, announcements, or discussion from anybody else? We already heard Jen's announcement, but Ginger didn't get to hear it. So Ginger, it has been shared. Any other announcements or questions?
Happy World Diabetes Day, everyone. Timely that we had this meeting today.
Indeed. I absolutely planned it that way, Kim.
Yes, I know you did. 5 stars.
Can I ask, I'm struggling staying motivated to do this because this is like a 1% of my job that is taking up 99% of my time. And I don't know how to do it differently, or I just don't know.
Thank you for asking, Jill, because it's a vulnerable question to ask. So I appreciate you asking that. Are there any coaches in the meeting today that have any insight that they'd like to share about maybe feeling that way, or ways that they've worked to stay motivated, or things that they work to do to help the class run smoother? Or maybe the first class, Jill, I know it's your first class, maybe the first class is just the hardest as you're figuring out those flows.
not having a second chair, right? That second person to help you through that makes it even tougher, Jill, for sure. You know, you're learning on your own, and I would really look at, I'm kind of looking at my friend, Jen Wonderlick or Mary Kay, and saying, if you had a buddy in one of these two women, and this goes for you too, Flo, when you're a new coach, having a buddy, somebody who really has been there and done that, could be really beneficial for just a coffee break, virtual coffee break or something, to just hang out with each other and get those tips and tricks and emotional support going.
Well, and I'm the people that I have in my class, they're very committed, but they're sick of it already. And the weather has not been bad. So it's not that. And I'm just afraid of what the next 10 weeks are going to be like, or 10 sessions.
That's good to know, Jill, honestly, because that falls under my realm eventually as a master trainer of camaraderie and coach support. And that's a discussion that I've been having with CDC and DTAC, my training organization, on what we can do within a UHA specifically. So I don't have anything right now specifically concrete. But I will take that feedback back to them when I meet with them next week and see if they can give me any turnaround guidelines right now that I can give to you within what I can on that aspect. But honestly, as a coach itself, my first two classes were the hardest. And then after that, it was way easier. Mary Kay, you could probably say the same. I know that doesn't help a lot. But it's, yeah, that first one, especially when I didn't have a co-leader, that was really, really challenging. And as soon as we started adding co-leaders, or even our first time when we added like a volunteer helper, that was huge. Do you have somebody in class that would be like amazing and stand out? They could help with like just maybe setting up coffee, or like giving other encouraging feedback, or just having a plant in the room, like to start some discussions with that when you do open-ended discussion.
I can't even get all four of them there at the same time.
Okay.
Like I said, it's 1% of my job, 99% of my time.
Yep.
And I'm hating it. I'm hating it. I wish I wouldn't have done this.
I'm sorry to hear about Jill. Does your boss know? Been able to talk to her about it?
Oh yeah, she knows. That's why she said, do you want to do another class in 25? And I said, no, no, please no.
Okay.
That is hard, Jill, because I know you were so excited to get the class going and get the people that you have signed up, and it just sounds like it hasn't quite panned out from the participation and engagement perspective in the way that you had hoped. And I mean, I had hoped too, honestly. I think we all want your class to be a success.
Wow. Okay, thank you.
Hang in there. And yeah, I'll say what Rachel said. Thanks for being vulnerable and bringing it up, because it is tough. It's hard work that you guys are doing. And thanks for doing it, Jill.
If these classes were easy, everyone would be doing them all over the place. It's their effort. And it doesn't always go as planned, and that's hard.
Well, I think when they say that you don't have to be a medical person to do this, I think that's a stretch, because I think that would be very helpful.
That's good feedback. Thank you, Jill. Any other questions or announcements? Well, hearing none, my final announcement for you is that this is part of Stacy's transition. These meetings, they've been scheduled on Stacy's Zoom license. So for our next meeting on January 9th, please watch for a new meeting invite with a new link. So this will be our last meeting on this specific Zoom link. All right, well, thank you, everyone. We have a wonderful holiday season. Stay warm. May the roads be clear, but may we have a little bit of snow, just a little bit, because it's pretty.
Yeah, you want us to go back to Africa, right?
Yeah, that flow is, she's already threatened us now a couple times this week. She's worrying about freezing her face, I think, right?
Oh,
Yeah, yeah. Okay, you guys have a great holiday and let's see how January 2025 looks for us.
absolutely. I have a good
Yeah,
feeling about 25.
yeah.
Good.
Bye-bye.
Bye,
That's
Bye,
a very good
everyone.
odd number. Yeah, bye. Mhm.